Hello and welcome to the Equiline Podcast. This is Dr. Wendy Coren.
This is Dr. Dave Lundquist.
And today we have what I'm expecting to be my favorite guest because Dr. Kevin Toman is with us, a veterinarian in practice, almost as long as me, not quite. But the topic, which is near and dear to our hearts, is longevity. So Kevin, welcome. Welcome.
Well, thank you very much, you guys. I appreciate the opportunity to visit with you.
So before we start asking you questions specifically, can you tell us a little bit about your journey? Because I know you started out quite allopathic and moved into longevity from there. So let's tell people why you're interesting.
The topic of why I'm interesting might be a very short one, but I will give you a little bit of a summary of my journey. And that is that I graduated from veterinary school back in the dark ages of 1986. And as Dr. Wendy suggested, the reality is at that point in time, we were pretty much told that there was just one road to pet health, and that revolved around allopathic veterinary care, the use of vaccines, the use of spays and neuters to keep our pets healthy. But the longer I was in veterinary practice, the more I realized that there was validity, that there is validity to the use of chiropractic care. There is validity to the use of Eastern herbs. There is validity to the use of prescription longevity drugs, which I'm fully prepared to talk about today. Because, here's where I start waving my arms around and say, instead of just one path to best health for our patients, the reality is I think all of our pets are whether they be horses, dogs, or cats, are best served by having a surgical cure and a steroid cure and a chiropractic cure and an acupuncture cure and an herbal cure. And if you and I can bring all those modalities together, I think our patients, regardless of how big they are going to be best served.
100%. We often say, and one of our mentors has often said, N equals 1. Each animal, each human, everyone is unique. And the technique, we currently have a lame dog for no reason other than she decided to wake up lame. She's coming 3, and she's a German Shepherd. And so she has so far had chiropractic, acupuncture, herbs, homeopathy, laser, PEMF, because we have all the toys. And it's like, don't make us look bad. You will stop limping. I'm not proud. It's about us, not about her. But and you watch what's working in this case under these circumstances, and it's got to be different. And, if you've got as our Jack Russell had, a gram-negative lung infection, we're not going to adjust it away. Or at least I'm not, So hence all of the things. And I heard you on another podcast talk about how people speak to their veterinarians, and you were asking a question of, does my dog need a vaccine? And I loved your answer about how they pause and how they explain.
Yeah, well, the reality is that, and again, I'll harken back to my veterinary school days when I was told that every pet and every horse needed annual vaccines, no matter what. And now, through those 4 decades of clinical knowledge and clinical mistakes, the reality is I've learned that nothing could be farther from the truth. The reality is that every pet, every horse's preventive therapy ought to be dictated by that pet's individual lifestyle. And the thing that worries me most of all is the fact that in dogs and cats, and let me speak directly to cats in particular, we know now that every time I poke a kitty with a needle, I'm creating the risk of an injection-related sarcoma, which is a fatal skin cancer that I cannot solve by surgery. And that's why, Dr. Wendy, if you've been to your veterinarian lately and taken your kitty in, for instance, for vaccines, they, instead of vaccinating in the scruff of the neck, which is the way I was trained back in the day, now veterinarians coming out of vet school are told to vaccinate as low down on the foot as possible. And so the rabies goes in the right hind foot, leukemia goes in the left hind foot. Why? I mean, this is a very painful and technically very difficult place to inject. Why do they do that? Because if you have to amputate that cat's foot as a result of a vaccine, of an injection-related sarcoma, it's an easier amputation. And that just drives me, frankly, batshit. Because, I mean, to me, there are clear indications for vaccines. And I would tell you, and I'm not going to monopolize the conversation here, but I went through the original canine parvo outbreak back in the late 80s. And canine parvovirus killed pretty much every dog that it came in contact with. And so I fully advocate for vaccines, but I fully advocate for a rational set of vaccines that are based on your pet's lifestyle rather than what somebody read in a book.
Oh, and having and I will say this out loud, corporate decision making that says if they come through the front door, they're getting rabies every year.
Yeah.
Because the same vaccine that they would give for the 3-year, it's corporate policy that they get that yearly. And there's a tough one for those of us who worry about what if your dog draws blood on someone and they don't have current rabies. You know, you don't. There's a chance that dog will be taken away from you and killed. So how do you balance, those choices?
Well, rabies is kind of an interesting dilemma, isn't it? And you brought it up, and so I'll riff on that for a little bit, and that is that current rabies vaccines are mandated essentially for all dogs and cats across the 50 United States. And why is that? Because rabies is traditionally the only disease that your dog can give you and me. And it is a fatal disease, to be clear. I mean, I went through a rabies prophylaxis vaccine series where I got 32 injections into my abdomen at one point in my life. So I'm an expert on the rabies part of things, baby. But the reality is also that now our vaccines are so good that for many of the pet vaccines, and I can't speak to horses anymore, although that's the way I started my career, but many of the pet vaccines we know, science tells us, are good for 5 to 7 years. Not just 1, not just 2, not just 3, but actually 5 to 7 years. And so is there logic behind doing a blood titer for these instead of mandated vaccines? Absolutely the case.
Well, that's what we do with our horses for worming. It used to be you just give it daily Strongyl, but that's how I started. And now we do, is there something to kill?
Sure.
Before choosing whether or not to do it. So that's, I think, one of my major motivating factors for having you here is let's educate people. Let them make informed choices as opposed to I have no choice as the rule. Yeah, and the more you can educate on all, riff away. Dave's a bass player. He likes riffing. So, that's what I said. We'll start on one tangent. There's nothing, I think, that you can say that's your experience in healthcare and longevity that we can't learn from. So wherever you take us, we're going to be grateful about that. And
well, thank you for the opportunity. The reality is that I think good veterinary medicine, just like good human medicine, is really much more an individual endeavor. Instead, you and I were probably taught to treat lab results or X-ray results at one point in our careers. And the reality is that I found that to be singularly unsatisfying. The reality is that I listened to
off camera. We'll talk about the insanity of the ineptitude of many of the labs for X-ray, MRI, all of those things. And that's the problem is we know enough to know this doesn't make sense. Or I'm looking at a herniation and you manage not to see that. How is this possible? All of the things. But since we promised people that we would talk about longevity, I'll bring us back to, where I say everyone wants their animal to live as long as possible, as healthy as possible, and there to me is
quality
care.
Right.
We laugh. We had a Jack Russell that lived 19 years, although the last year alive was maybe she was
Was
alive
tenuous.
somewhere. She was not mentally present, but she was
Right.
physically present. So,
Right.
so what made you veer towards longevity? And, you know, is that a factor in healthy longevity? Not just expanding time, but expanding quality.
Right. And this is another area where if you and I were in person, I'd sit down and draw a big graph. But the reality is that traditionally, in both human and veterinary medicine, your quality of life starts high, and then just there's a linear fade with time. And my belief, and I think it sounds like yours as well, is that there are ways that you and I, working together, can create a much more of a plateau on the quality of life, a high quality of life for as long as possible. And then when the inevitable decline happens, let's make it a short and sweet decline, where you just kind of fall off that table cliff. But instead of suffering for a year, as your Jack Russell did, or I look at my mother, who was a smoker, bless her little heart, and she spent the last 2 years of her life in bed because of lung cancer that had spread to her bones. And that's not quality of life for any of us. And so you and I can talk about lifespan, but perhaps a better approach is to talk about health span. That seems to be the buzzword these days. And if you and I look at how do we achieve maximal health span for the people, for the pets that we love, I don't think there's anything more important in the world than that.
Uh, exactly. And from now on, health span will be my new word. I'm replacing lifespan, because I lost my mom with Alzheimer's,
Yeah.
and lost her before I lost her. But the congestive heart failure that killed her, she had to linger with because there was no longer a human to communicate with. When our shepherd went into congestive heart failure and she looked me in the eye and said, "Please don't," we were able to make a choice at 14 years old.
Yeah.
So we go, wow, her health span was amazing.
Absolutely.
And celebrate that. And I am sure that you have thoughts in terms of eating, exercise, all of those things that assist them on an individual basis. So can we talk to that?
Sure, absolutely. And I can, I can go ahead and run with it, or I'm happy to answer questions. I mean, whatever.
I'll run with it.
Yeah, all right, all right. Well, for me, I think that there are perhaps three different pillars to longevity as I define them. And the first is developing a relationship with people that you can trust, whether they be chiropractors, whether they be veterinarians, whether they be physicians, whether they be nutritionists. The unfortunate truth, and you alluded to it earlier, is that in current veterinary medicine, about 40% of veterinary clinics are owned by corporate entities. And therefore, these doctors are typically, and bless their little hearts, they come out of school and they're sucked up by these corporations. And so there are many of these veterinarians that don't have a great deal of experience. They're told exactly what drugs they can use and when to use them. And so much of the latitude, much of that experiential learning that you guys have gone through over the course of your careers has been taken out of the equation for veterinarians in these corporate practices. And the other thing that drives me just a little bit crazy, I may not have been the world's best veterinarian through my career, but one thing I prided myself on was being a relationship builder. The fact where when your German Shepherd came in, I would recognize your dog and say, "Hey, Jill, how's it going?" And hi, Wendy, how are you? And and give you a hug and let's sit on the floor and talk for a little bit as part of this veterinary exam. And I think, sadly, that at least in veterinary medicine, that's a little bit of a lost art. And so, what I propose as a solution to that is the model that I'm practicing right now, or kind of a veterinary medicine 3.0, which is a consult-based therapy. Because I think that if you and I look at where you want your young Jack Russell Terrier to be in 5 years, well, that's predicated on two things. That's predicated on where they are right now. Let's get the very best assessment of their health right now, not just from a traditional perspective, but using all the different modalities, whether it be chiropractic care, nutritional care, whatever. Let's have the very best understanding of where a pet is right now. And then by working together on one of these longevity consults that are a passion of mine right now, you and I can develop a strategy. We can look and say, hey, what is that Jack Russell Terrier's actual risks, where she lives in Wellington, Florida, as opposed to just reading out of some handbook someplace. And, where does she walk? How many dogs does she run into? What are her genetic risks of dental disease and heart disease and cancer and allergies and some of the other things that affect Jack Russell Terriers? And build a plan, not just around allopathic veterinary care consisting of shots and needles and sprays and this and that, but nutritional care, chiropractic care, the use of proven supplements. Supplements that are, there's a lot of bullshit out there in the supplement game, guys.
Oh, yes.
Yes,
And,
we get those questions every day. And my first comment is I want to clone you and have you move here so that you can see every one of our patients. And the second is, I want you to continue this because you said 3 pillars and trust was the first one. And I wasn't sure if we were getting into strategy as the second one or that was under trust. And
okay, well, let me clarify that for you,
So
because it doesn't sound like I've done as good a job as I would
And,
like
and
to.
I want you, the other thing I was thinking of is the reason we chose our current small animal veterinarian is because when I brought my shepherd in after my horse kicked her and broke her leg into many pieces, the first thing he did was get down on the floor, go nose to nose. Our half-hour appointment was 20 minutes of petting her and telling her how beautiful she was, and 10 minutes of, well, yeah, we'll do some stem cell to help this heal. And I'm like, okay, you're my human.
There you go. Yeah.
God appreciates you too. But that willingness to have a relationship I didn't even know, that wasn't what I was going there for. I was going there for post-op. And instead I found someone who was, and they weren't trained that way. And that's the problem sometimes when we try to train people. You have to be born that way and then hone the skills.
Plus, it was a non-corporate vet, and all the other vets we've been to have been all corporate.
Yeah, we actually found out from one of the corporate people in our life that they now own 75% of all small animal clinics in the U.S.
Yeah, well, that might be a little bit of an exaggeration, but it's not too far off, and it's increasing.
It's a lot. So let me go back to your pillars and interrupt you less.
Oh, no, not at all. This is very much a dialogue that I enjoy. And so the reality is, again, I would state for the record that there are, in fact, 3 pillars to optimizing your dog or your cat's lifespan. One is finding that relationship with a veterinarian that you can trust. And to address your issue, veterinarians, when I went through school, I was taught how to take histories. I was taught how to make presumptive diagnoses and develop a little bit of a treatment plan. But one thing I was not taught how to do was to sit down on the floor, to use your example, and to develop that relationship with not just the pet, but also the pet parent. And I certainly was never trained, and I think this is true today. Veterinarians are not trained to think proactively in how best to help your pet to develop a strategy for that next 5 or that next 10 or that next 15 years. We're hell on wheels when it comes to sewing up a cut or treating an abscess. That veterinarians are very good at solving those problems. But when it comes to proactive thinking, there are few of us that really work hard at developing those strategies, and that's what matters most to me. So the first one is the first pillar, to use your phrase, is just simply finding the right person, finding the right team. Finding the right partner, I guess, would be the best way to phrase that. The second component to it is that transfer of information, from that veterinary partner to a pet parent, and from that pet parent to the veterinarian. Let's develop a relationship within the frames of this consult that you and I just spoke about. And for instance, with my consults, I ask pet parents to fill out a 5-page handout on everything that goes on in their home, from what they feed their pet to how many other pets they have, whether you have stairs in the home, because stairs for a Jack Russell will eventually become a problem. For a German Shepherd with a genetic tendency for hip problems or elbow dysplasia, those stairs will eventually become a problem. Same thing with tile or with hardwood floors. And so I spend a lot of time just discussing the propensity for slips and not so much stripping, Kevin, but slips and falls that will come back to haunt a patient.
I'll interrupt you. We watch every dog client that comes here. I walk out and I watch how they get out of the car, how far they have to jump, how that person scoops them, and whether they can press them or do that. And they are educated from the first minute.
Yep.
And then I yell at them every other time because they forget. But okay.
So in addition to my little 5-page handout that I make you fill out, which it does, there are forms for vaccines and for flea and tick preventives and the like, but those are some of the least important components to this information that I'm asking for. And then to complete the picture on my end, I also asked for the last 2 years of a pet's veterinary records, because listen, I am a believer in diagnostics. I am a believer, for instance, in anesthetic dental care for these pets under 20 or 25 pounds, and I can speak very directly to the benefits of that. But the bottom line is that at the end of the day, my goal with these consults, and I would urge your listeners to think about this, is not just to develop that relationship with a true partner, but also to share that information, share information back and forth, and be able to ask each other questions. And here's the caveat: to still be friends. You and I, you, Dr. Wendy, and I might disagree on a number of different things, when it came to the care of an individual horse or an individual dog. But if we can sit down and we can explain, hey, this is why I believe this. I'm not just, this is not just policy. This is why I believe it. And listen to you do the same thing. Well,
Dr. Kevin?
Well, won't life be fun?
Right. Well, there's my husband and my son and myself in this practice. And we can be in a stall with a horse. And Dustin's a veterinarian acupuncturist. So the questionnaire that you talk about, that is a normal part of his questioning of that client every single time.
Sure.
Looking at them as an individual. The three of us will nearly come to blows, having different opinions, looking at the same client. You said you want 5 opinions, ask 3 people, because I don't always agree with myself. But at the end of the day, we're all on the same page of wanting to do what's best for that animal.
Right.
That to me, if you want to be my friend, be wanting the best for whomever's in your care. I'm going to respect that even if I disagree with it. So
sure. There will always be a spot for honest collaboration.
Exactly. So transfer of information is a second pillar.
Okay. And then the third is the actual execution. That's where we get down to the nuts and bolts of this, where we start thinking about diet, we start thinking about lifestyle, start thinking about the role of allopathic veterinary care, which in many cases is rather than vaccine-based. Let's talk about the right diagnostics. Let's talk about the right, about the dental care that every pet under 20 or 25 pounds should have so regularly. And then we start talking about the supplements that actually make sense. We only carry probably 16 or 17 supplements in our whole little store, but I can tell you exactly what they do, and I can tell you exactly whether they will help or hurt your pet. And when you and I thumb through the Chewy website, for instance, there are hundreds of supplements, but how many of those are proven, and how many of those where do you go when you are looking for help selecting them? And then the last component to this, because I'm on a roll now, and you're not going to interrupt me. I'm going to get all the way through these 3 pillars if it makes or breaks me. And the last one is prescription longevity drugs. Because my position on this is that there's and again, I'm 66 at this point in time. And so that longevity science matters a little bit more to me than it did 10 or 15 or 30 years ago. And so I pay religious attention to longevity science coming out of the human trade. But why is that limited to the human trade? Why is that limited to human medicine? My personal stance is that every medication that you and I can use in a human should be at least evaluated for veterinary care. And I take rapamycin for longevity on a weekly basis. I also use that in perhaps 70 to 80% of my pet patients, not just for longevity, but because it helps to reduce inflammation. And in particular, the rapamycin has been shown to benefit health span by up to 14% in every mammal species studied to date. How does it do that? Two things, really. I mean, well, a number of different things, but the big two are it reduces inflammation and it has broad anti-cancer properties. So let's use those prescription longevity medications for the benefit of our pets. And, I think it's just something that, again, when you and I start, let me rephrase that. When I start, drawing all these vectors into a patient and saying,
okay.
listen, I believe in acupuncture, and I believe in herbal care, and I believe in the benefits of scalpel blades and steroids and everything else. But I also believe in the benefits of prescription longevity drugs, and that cutting edge medicine that is benefiting humans can also benefit our pets.
So these are prescription, therefore you need, in order to get this, find a veterinarian or a physician if you're human, who's on board with
Correct.
This. And that's challenging for many, many people if they don't have access. So I want to understand the mechanism of doing that. And then, to devil's advocate a little bit, what are the downsides of it?
Okay. Well, so I'll address the first, and that is that you are correct. Some of these drugs are prescription. And so by definition, they need a prescription from their local healthcare provider, whether it be human or veterinary. The fortunate part about current telemedicine laws is that I'm able to do consults in some states on a remote basis and so prescribe those longevity drugs. And so that's a significant benefit at this point in time. And listen, telemedicine in general, I think, is an evolving business, and what we can do now may be greatly expanded within 2 or 3 years, might be greatly subtracted within 2 or 3 years, depending upon the policies of the administration and the like. But at this point in time, I try to work not so much instead of a local veterinarian, but alongside that local veterinarian for optimal care of their pets. And so when you speak about the question of side effects or potential negatives, that's a question we should ask ourselves with everything you and I put into our mouths or put into our pets' mouths, whether that be with an aspirin tablet or an antibiotic or, in fact, a prescription longevity drug like rapamycin, because there's a saying, and I don't know if it's true or not, but if aspirin, the same baby aspirin that you or I would take, if that had to go through the FDA process these days, it would probably fail because of the percentage of GI ulceration cases that you run into. And so every drug has its risk profile. And the good news is that, I'll speak to rapamycin in particular. At higher levels, it's considered an immune suppressive in human medicine. And in fact, it's a first-line drug if I was to give you, Dr. Wendy, my kidney, you would be on immune suppressive therapy, and rapamycin for many years has been high on that list. But at the low doses that you and I are using in pets for longevity purposes, there don't seem to be any side effects whatsoever. About 3 to 4 of my patients, let me try that again. 3 to 4% of my patients will develop some stomach upset, typically manifest as a little bit of soft poop. And that typically resolves after a treatment or two, but there have been a couple of cases where it just simply became impossible to use. But if you and I on a
right, any food can have that reaction, and
right, absolutely,
basis. Right? No, that's very, very exciting. And telehealth is very exciting. And unfortunately, as a chiropractor, there's very little you can do with your hands over the phone. I have recommended people pick up a house phone and smash themselves upside the head, see if they can get that
But
out.
that's a different conversation. We'll cover that conversation
truly,
offline.
we've done fascial work and kinesiology taping for animals all over the world via telehealth. So it is remarkable how much you can work with someone local to enhance what's going on, and that's extremely exciting. And so,
I'm going to interject in the spirit of this true back and forth conversation here. One of the things that our practice has evolved towards is cancer care. And the reason for that is, of course, well, number one, cancer is a very legitimate concern for the older demographic of pets that I love to help. But also, at least in the veterinary sphere, true knowledge around cancer care is a very hit or miss thing through much of the United States. There are only approximately 250 veterinary oncologists across the United States, and those unfortunately are centered around universities, centered around the larger cities, and predominantly the coast, to be honest with you, whether that be your Florida or my California or the Seattles or the Texases of the world, the Bostons. And so what about, and I'll pick on people here because I used to live in a little town called Wise River, Montana. What about that dog in Wise River, Montana, whose owner was just given the diagnosis of terminal cancer? Where do they turn? And so one of the things that I truly love about the direction that my practice is taking is the ability to help these pets that are in the Wise River Montanas or in the Skowhegan Maines, where there's very little in the way of actual veterinary specialty care, because I'm old. I've learned a lot along the way, but I've also developed a relationship of oncologists that I can call with and get answers to questions for pet parents that don't have the ability to take their pet to a veterinary oncologist. And so this is a very rewarding component of my career. And really, I hate to use this phrase, but it's I kind of think of it as the democratization of good veterinary care, because I'm trying to spread that gospel across the more rural or the underserved areas in the United States.
Is it effective for in the cancer care for things like osteosarcoma in the large dogs, or is that a separate?
Well, so if you're asking specifically about rapamycin, there was a great deal of early excitement about rapamycin for osteosarcoma, which is the most common form of bone cancer in large dogs. Virtually all Great Danes, all Irish Wolfhounds will get bone cancer at some point in their life if something doesn't kill them first. And so that's a very legitimate question that you've spoken about. And to directly answer that question, UC Davis put out a position paper about 7 years ago stating that rapamycin was effective for osteosarcoma, but then that was followed by a meta-study that showed that, in fact, there was no survival benefit for the average osteosarcoma patient given rapamycin. And so there are new therapies that are coming down the pike for osteosarcoma, both in terms of specialty care like radiation, and also, interestingly, some monoclonal antibodies like Gilvetmab from Merck. And these do give us hope, at least in prolonging the quality of life for these patients with osteosarcoma. But at this point, I have people who request rapamycin for their pets with osteosarcoma, and there's no contraindication. But I'm also clear that there's no substantive benefit been shown.
Well, I had a specific patient in mind when I said that, because a almost 300-pound Mastiff was referred to me because it was limping. Had 4 prior visits with its small animal, or large small animal in this case, and he walked into my clinic limping incredibly, and I went, has he been x-rayed? And the response was, no, he's too big for the table. So I called my large animal vet, who came over in
Yeah,
20
girl.
minutes, and it was a massive, now this is July, massive osteosarcoma. The bone was completely blown out, and I said, I shouldn't be the one who noticed that. However, I was. And they used a combination of a antiparasitic and CBD, and the dog is not limping. There's bone growth around both sides of the tumor. He is better. He's been getting chiropractic and taping on either side of but here we are, 7 months later. It had not metastasized at that time. And there's no evidence that it's metastasized at this time.
Well, that's wonderful. I
don't know if this is a one case in the universe, but
it may be. It may be, in all honesty. But you know what? What the hell? Isn't it wonderful?
Yeah, I don't know if it was fairy dust or whatever. But I was just curious as to whether or not there was anything, because when people say to me, as they say to you, and when people used to come into my practice with 5 bags of nutrients when I had a human practice up in Connecticut. And if you don't believe in, diseases, live with some ticks for a while, you'll be a firm believer in the efficacy of parasitic tick-borne diseases. But they'd come in with 5 bags of nutrients. And I'm like, if you were that deficient, you would be dead. There's no such thing as needing all that, and you can't possibly absorb it. So our process, and Dave and I are pretty much the same on this, is show me the science. You want to do that? Just let me see something PubMed or VetMed published, not prevention published.
Yeah.
And that's where I go from there. But I was just curious, because this is such an awesome miracle that if there was something you recommended, I just want to pass it on. And if not, we'll just keep going for, hey, if you get a miracle, accept it. And, it's okay.
Never discount a miracle.
Never discount a miracle. I'm one, so we'll talk about that another time.
Okay.
So we've got our pillars, which I counted 4 out of 3, which I love, and people can reach out to you for telehealth. Even my clients from here,
Absolutely.
Which is
I'd be honored to help them.
Exciting. I love the idea of your questionnaire. I love the idea of just getting people to understand who they can trust, who they could possibly work with, just regular, getting blood tests so that you have a clue how your animal is when they're not suffering. Because as you say, when I opened my practice in 1980, I wanted to name it the House of Last Resort. Because at that point in time, chiropractic was, not considered in any way mainstream. Unfortunately, as it became more mainstream, it became more like the allopathic, your C5, T12, L5, have a nice day.
Right.
And that's not good for anybody. So do you have more? You look like you had a question.
No.
Okay. It's just, there's so much.
We could go on with this for hours.
We could go on with this for hours, and we want people to be able to, get out of the car after the podcast and still be able to function. So what I'd love you to do is just tell us how the best way people can reach out to you, where they can find you, and then we'll set up our next podcast so we can ask you more questions.
It sounds wonderful. Okay, well, I'll answer that by confounding folks. I have 2 different ways to get in touch with me. The website that offers you most information, not just in terms of products, but also there's a huge amount of video and written information, is my website, www.helpingpetslivelonger.com. That's my primary website, and there are several different email entry points. So if you have a question, please reach out to me. I am happy to help you. And, we are all in this together from a pet parent perspective. The second, the easier thing to remember, if in fact you are getting out of the car, is that Dr. Wendy and I spoke a little bit earlier about ways that I could reward your listeners. And I have a website, www.freevetcall, freevetcall.com. And there's a calendar on there. And if your listeners want to make an appointment for a free 10-minute consult on helping their pet live longer, live more healthfully, that's the deal. That's what I'm offering your listeners.
More awesome than we expected, which is pretty much because after I checked out, I expected a lot. So I thank you from the bottom of our hearts for joining us today, for giving us so much information, and for helping inspire our listeners to demand the best possible care for their animals and participate in it. Because
yeah, it's pretty important. You know, what I would leave your pet parents with is this. I mean, the choices that you make today will dictate how long you have your pet tomorrow. You know, so let's get cracking. Let's get cracking, you guys.
Let's get cracking.
That's what we do best.
All puns intended.
That's right.
This is Dr. Wendy Coren.
This is Dr. Dave Lundquist.
And this has been an Equiline podcast.